Thank you so much for having me. I am really grateful to be here and also meeting my teachers and professors as well. My name is Zephyrus, or Zeph for short. My pronouns are he, him. I was graduated from CUHK in 2019. Of course, I'll also talk more about my journey later on. In our topic today, we will talk about the local trans community and the gender-affirming healthcare services, and also, even though we may not be seeing trans individuals every day in our practice, but there are also so much more things that are related to all of us. Before we talk more about being trans, here are some food for thought. When we think about men and female, what would you first think about? What really makes one a man and what makes you a woman? Now, you may also even want to think about when we talk about uterus, ovaries, or vagina, do they always mean female? And have you also think about if all women have cervix, or maybe only women have cervix? I wonder if you have also heard about someone saying that people who menstruate when they talk about menstruation. Thank you. Of course, there are also surgeries including hysterectomy, BSO. So is a woman still a woman after the surgeries, or would they think that they are less of a woman after the surgery? So these are all the things that I think are very much related to all of us in our daily life and our daily practice. And we can also think more about this during the section. Of course, more about this. This is one of the local exhibition on menstruation, and the word "people who menstruate" or "Leugingter" is also used more and more popular nowadays. Apart from these local sources, I also look into, for example, NHS when we are talking about cervical screening. So just to we should all pay attention. It says that it's offered to women and people with a surface. So when we think about, oh, is there any reason why they would put down not only women, but also people with a cervix? So it sounds like anyone or everyone with a cervix. Also look into the Instagram of the Royal College of Obstetricians and Gynecologists. It also says that in the introduction, that what they do is to improve the health of women, girls, and people accessing ONG care globally. So is there more meaning to all of these words? And of course, here's one of the news. Actually, in 2021, the reason why that when we talk about cervical screening, it sounds like we wish to talk more about people other than women, or if they have different gender identities or different sexual orientation, just because that there are unpleasant cases or complaint cases that someone are denied of doing this screening just because of the sexual orientation. Of course, getting into the content related to Pride Month and being transgender. Earlier we talked a lot about this, about being Pride Month. You may have even seen rainbow flag everywhere as well. But I'd just like to point out that rainbow is not actually only for minorities. I will always think that it is including everyone and every identities. And only when we're talking about whether you're heterosexual, homosexual, you are cisgender, transgender, every identity is adding together. It is what makes a really diverse society. And of course, we are seeing everyone in all walks of life in our daily practice as well. Of course, for the trans community, we have our own pride flag as well. So you may have been recognizing these colors. If you can really remember it, you can also think of the bridge in Naotogo. So this bridge, or you may call it Zimenkyo in Naotogo, is actually in the same color as these trans colors as well. I think I'll also talk more about the meaning of pride, especially being really grateful to be here to talk about it in June. I'll just first begin by talking a little bit more about myself. in the LGBTQIA+ community, I belong both in the trans community as a transgender guy and also actually in the gay community as well, because I'm also a guy who likes guys. I would say that it is actually the so someone do ask me if I am, for example, when you say you are a transgender man, are you from female to male, or when are you changing it, or why are you changing it? I would actually say that I have been thinking I did not change at all, and I have been male all along. But then, of course, I would also say that it would be the most important year of my life during the final year of my medical school. So the times I spend here is actually almost the time that I began to really live as a guy, as who I am. And so apart from being, well, socially, maybe having shorter hair after a lot of discussion with my family, and maybe having, well, the clothes that I want to wear at school and during and in the ward, there are also other things, including maybe having a chest binder, especially when we're talking about there may be different extents of gender dysphoria a trans person may be experiencing. For myself, for example, since puberty, the kind of discomfort of feeling what I don't really like the breasted feminine is something would be very stressful for me. But however, having a chest binder, I think feeling like into myself is something really important to me. Of course, at the same time, during this final year in my medical school, it's also the time that I started the testosterone injections, or sometimes as we call it on T, since T stands for testosterone. So all the really physical changes and being able to live as myself and going to school, meeting my friends just as who I am, is a really important and arguably most delightful time of my life so far. So after graduated, and also, well, this picture would be in the houseman year, also spend some more time and to thinking more about who I am, and also, of course, saving money. And so I actually did my top surgery, or you may say the mastectomy or removal of the breast, just 2 years ago. I would say that these are some of the most important things that are happening in my life. And apart from this, I have been also making significant and great friends in the both cisgender friends and also with my transgender friends as well. These are also giving me the opportunity of doing sharings or workshops like this, talking to the healthcare colleagues and students, and maybe in different fields as well. They may be well, social workers, corporations, when we're talking about the topic related to diversity, equity, and inclusion. The last one about a Hong Kong ID card is also something quite interesting as well. You may also say that I am eligible in changing my Hong Kong ID card into saying male. But then, well, I haven't done so. I haven't sent in the application form. And you may also thinking that, what if I'm admitted to your ward someday? So on my CMS or Hong Kong ID card, it may says F, or it may says M, or I may be the only man in your ward as well. Of course, we'll talk more about that later. So first, just a quick question. So maybe a show of hands. How many transgender people you think there are in Hong Kong? So, okay, you may be thinking, oh, are there really so many people who have done surgeries also? So let's just give it a try first. If you are online, maybe you can just write down the answer. So who you think that there are around 2,000 something people? No? Okay, how about boy? 5,000 something. Okay, more hands. Thank you. How about option C? Okay, half. Okay, anyone choosing dog? Option dog. Okay, we have one hand, two hands. Thank you. So, the correct answer is actually the biggest number. There will be more than 20,000. So across different countries and areas in the population, there will be, in a very conservative way, at least there are 0.3% people. So we have been also thinking, yeah, the same question. Is there really so many people have undergone, for example, sex organ surgeries that we don't know of? That also comes to how we are defining being transgender. Or when you think about it, how would you call someone who is not transgender? So I've heard some of the friends would maybe say that, oh, they are the normal people or the majority. Okay, majority is okay, but we'll also think more about what is normal, what is diversity, or what is, well, a disease later on. So of course, there are some official definition. So for someone who is not transgender, we will call them cisgender or 順性別. So it says that one's gender identity is the same as society's expectation based on the assigned sex of birth. As for being transgender, then it means that their gender identity is different from the assigned sex at birth. So just try to remember the two keywords first. The first one would be gender identity, 性別認同, and the other one would be assigned sex at birth, 出生指派性別. These definitions sounds a little bit complicated. We will try to explain more now. So the first concept when we think about this assigned sex at birth, we're actually talking about the ways that we are seeing gender. So there are actually different ways, and adding all of them together would be actually giving us more point of view. So of course, this is something that we are all very familiar when we are thinking about gender. Maybe we think about sex organs, maybe, well, penis, some people would think, oh, it would be related to men. And when we're talking about vagina, uterus, ovaries, etc., we may think about it would related to female. And a very good example is that on our birth certificate, well, if we know that which kind of sex organ you have, then it will be filled on your birth certificate. So when I was born with, well, vagina, and it is also written as female on my birth certificate. So some people will also say, oh, maybe there are also some people with other sex organs as well. But of course, they will be the intersex individuals, and they're actually not really directly related to our topic today. So intersex is different from being trans. Apart from this perspective, I also like to talk about, of course, we're not talking about pushing you to believing something, or these concepts may sound a little bit difficult at the early on, but it would be quite important actually to have it understand that, oh, it explains why some people are thinking about themselves, or why some people are seeing gender in another way. So when we're seeing gender more with gender identity or 性別認同, so related to our personal sense of feeling about who we are, which gender that we are, and also more or less, apart from the feeling, is also directly related to the way that we are living. For example, well, living as a guy. So these are all really important in our daily lives, and also how we are interacting with people and respecting each other. So in this diagram, it is actually telling us that now when we try to define male, male actually includes cisgender men and transgender men as well. So men would be a very diverse group. They may be having, well, different bodies or different experiences of growing up, or even different sex organs, but their gender identity is also male. They're also living as male. And of course, the same as female. So in this context, when we're defining with gender identity, so female will be including cisgender women and transgender women. So you would be thinking about, would this be, so what would be the female experiences? Are there different experiences of growing up, or what if they're having different bodies? So this is also something for us to think a lot about. Apart from male and female, there are also non-binary people, meaning that their gender identity is not male and not female, but just like a spectrum, or at least there may be 7 or even 10 colors in a rainbow. So there are also other different gender identities. So we just call all of this being non-binary. Just a quick show of some of the pictures. So for myself, Zephyrus would be a trans guy. You may have also know about Ella Page, which is also a transgender man as well. And these two pictures, this is a very famous transgender woman from Taiwan, Ngoi Lei Ai. This is actually also my Seymour. So another graduate from CUHK, Ming, and this is also one of the pictures during her wedding. So for non-binary, I've also put down some of the celebrities you may have heard of, for example, Sam Smith and some of our local friends who are also doing interviews as well. So hoping that this will be made beginning when you're thinking about the trans community, always including male, female, and also non-binary individuals. But of course, there are also, apart from talking about, what women may means or what men may means, I would also like to stress that, so some people are asking, is it also the same as changing sex or gender or being same? Or would you also just say that, oh, were you a girl before and you changed to a boy, or just wanting to be a boy? So some of these lines are actually also maybe implying or hinting the meaning behind as well. But I would rather suggest that maybe these are not the most accurate way that reflect my feelings. To some most of our transgender individuals, they may be just not thinking that they are changing, that they have always had this gender identity and also just happen having these bodies as well. It also comes back to why some people are saying related to menstruation. Maybe there are people who do menstruate and maybe having uterus as well, but they are not having a female gender identity. For example, I did have uterus and I did have menses before the testosterone injections as well. So these are also maybe something we wish to think more, and also just giving us more room for thoughts. But of course, we won't be saying that we will not like giving up the word women. So it is not something that we would like to do. However, we have been expanding and also imagining more about how we can be inclusive and also including more of our service users. So just a quick slide. Usually when we talk about all of this, sex and gender, there are actually different aspects. So earlier we have just covered two of them, gender identity and sexual characteristics, but they're also about gender expression, maybe about the way you dress, the way you appear, and also sexual orientation and romantic orientation is more related to by which individuals or how you'll be attracted or getting into a intimate relationship. So all these things are actually independent of each other. So for example, it also explains that for example, having a sexual characteristics that is having uterus or vagina, for example, does not necessarily followed by having a female gender identity, but they are all very independent of each other. So when they're in these wheels, and also sometimes we call it a rainbow wheels, these 5 aspects are also not just black and white or just A and B, but they're in a spectrum or in very different gender identities. So when we try to call all of these characteristics together, we can use the acronym called CUHK, which actually corresponds to SO would be sexual orientation, GIE, gender identity and gender expression. As for SC, that would be corresponding to sexual characteristics. So a little bit more to supplement. So sometimes when we think about gender identity, people will be asking, okay, so you say that you identify as a guy, so can I also say that I identify as a laptop, I identify as a pen? Well, I would say that these questions has been investigated thoroughly throughout so many years, more than 100 years in modern science and medicine. So these are also some more things that we'd like to talk about as well. I would say that the transgender and gender diverse these identities were really being put in the list of mental illnesses and for some time, and when they are removed from the list. This is actually not very long ago. So a very important concept, we call it the pathologization, both happening in important these lists of diagnoses, including the ICD and DSM-5. You may have heard previously that the term transsexualism or gender identity disorder is used, but now they are obsolete and not used anymore, since they are actually referring to something that are an illnesses. So now in the ICD-11, the word gender incongruence is used. Is actually defined just as how we are defining being transgender, that one's gender identity is different from the assigned sex at birth. As for gender dysphoria, this is something a little bit more complicated, but I would say that it is related to, of course, when one's gender identity is different from the assigned sex at birth, and also developing, experiencing the feeling that, for example, maybe related to myself, breast development, or maybe having a more feminine voice before. So these are all the things that are related, or being called Miss, because it's written on my Hong Kong ID card. So this is also not aligning with my gender identity, which can be all included at these experiences of gender dysphoria. So I would actually say that the reason why we are knowing these kind of updates in these very international classifications of diseases actually tell us that they may be still called as diagnosis, but they are actually not negative and not pathological in any way, but they are also part of our human diversity. And I will also add that you may have heard that maybe being gay or lesbian is also listed the same way just a few decades ago. But as we have more understanding and really having a huge change internationally, rewriting our knowledge of sex and gender, and this is also very important when we are treating our patients. Maybe they are carrying the concept, thinking that, oh, doctors will also think things that we have diseases. So I do sometimes think that we may have a little bit of a responsibility showing that how we are seeing what is right, what is negative, and also knowing what is actually just part of the diversity. Of course, in the same topic, when we know that being trans is not a mental illness, we will also know that there's actually no need for cure. And some people may even thinking that maybe we should be having the so-called conversion therapy. So, for example, telling me that, oh, you shouldn't be a guy, you should just live as a female, or telling someone who is gay says that, oh, you shouldn't be gay, you should try to be straight and try to get a girlfriend. So we are also thinking that, is it really necessary to do this so-called conversion therapy? And of course, we also know that conversion therapy is legally banned in a number of countries, since that there is, well, unnecessary, and they will only bring very long-term negative consequences. Of course, it also leads to gender-affirming healthcare when something does not need to be cured. We wish to be having a more affirming and a more respectful direction. So WPATH, or World Professional Association for Transgender Health, is the international guidelines publishing what it is called standards of care, including the area of, for example, mental health, hormone surgery, and so many different aspects, which is also widely used in different parts of the world. So just a bit more, I would say that the really important concept knowing about gender-affirming healthcare is that these are something evidence-based, of course. They're safe and effective with the aim of optimizing the overall physical health and psychological well-being. It's also really important that a physician is always partnering with a transgender individual. So they're involved together and really understanding what would be appropriate and suitable for them. Gender-affirming healthcare as a whole would be something medically necessary, or some even saying that they are life-saving, which is just as life-saving as any other healthcare services. But it's also important to know that it is very just like any other field. It is person-centered, so there is actually no really such thing as food sets or one size that fits all. So, for example, someone may be just needing hormones, or for example, another person will need hormones and maybe one type of surgeries. So you may have heard about, for example, complete surgery or full surgery. We also think that maybe these kind of concepts are also more related to the policy in the government. So just a quick overview. Local gender-affirming healthcare services, there are public services and private services. And of course, some people may be choosing overseas services, especially for surgeries. So in the public services, it is centralized in the Prince of Wales Hospital. That's the only gender identity clinic. It is a very multidisciplinary services, including psychiatry. Usually we can say that as a first stop, so first meet a psychiatrist first. And after understanding your the individual's gender identity and also the different needs, maybe more to do with their daily life or maybe their healthcare needs, they will also know that if they need to be referred in any way. So it also includes, for example, or the most commonly to endocrinology for gender-affirming hormones. It is. I've also added that you can think about the waiting time. So since the gender identity clinic only accepts those who are 18 or above, so when they are waiting to see the psychiatry, they will be 19 something, and they will actually have to wait for more than 2.5 years. So there will be almost 4 years later before they can be prescribed gender-affirming hormones. And of course, there are also gender-affirming voice and occupational therapists are also involved. And of course, what's more, there are gender-affirming surgeries. Apart from urology, plastic surgery, there's of course also the ONG department, and we'll also go through a little bit more later. So just a quick question, and I also believe that this has been covered early on. So I'll just say the answer very quickly. Of course, there has been actually more than 40 years that gender-affirming healthcare has been offered. You may also wondering if you may have heard of it since it has so many history, but I also say that it has indeed saved so many lives. So it's a very busy table, but then most importantly, for gender-affirming hormones, you can think of them as being those masculinizing hormones and feminizing hormones. So we didn't really cover about the puberty blocker here today. So I'm just focusing more maybe on masculinizing hormones first. You can think of it as having like a second puberty. So in a very comprehensive changes, it may include the voice deepening and also having the fat redistribution and more muscle mass. You may be also concerned when knowing that, then there will be also the stopping of menses and vaginal atrophy as well. So it actually also leads us to the next question. So of course, I have been indeed asked on my LMP, maybe just during when I employed getting into the hospital authority. So the real answer for my LMP is actually, I think, around 5 or 4 years ago. So you may also want to think about, oh, would you ask for this? Or would you have just asked anyone who have a uterus or may be, or would they be able to get pregnant? The other question, of course, related to cervical cancer screening, and of course, mostly we would be following international guidelines and of course local guidelines. But we may also want to think about that. If someone who is a transgender guy and they are also on testosterone injections, would they be also needing a cervical cancer screening? How would you order the screening for them? I think it's just a little bit of a detail. They're also related to the procedures. Since they are maybe vaginal atrophy, it is also suggested that they will be having, for example, more lubrication, having more speculum. So and I think just more understanding of the trans individuals is the most important thing. It's also quite important to think that so who would you think that I may be having sexual contact with? So would you think that I would get girlfriends or boyfriends, or maybe having different partners of different gender? So all of these are actually yes, because just like the rainbow words that we have mentioned, a trans man may be having girlfriends or boyfriends or having just partners of different gender as well, and they may also having a sexual contact that will lead them having pregnancy. So of course, if one do wish to pregnant is one thing, but if whether they able to get pregnant or having these kind of risks is of course something that would be taken in our consideration. Here just some of the pictures also showing that for this is one of the trans guys, maybe he'll be also having intimate relationship with a cisgender guy as well. So as for a transgender guy, maybe he is having a cisgender woman as his partner. And as for this transgender guy, he's actually also having a non-binary partner. So when you think about asking for the sexual history or other history taking, so there are also a number of things that you may wish to consider. Just a quick slide about gender-affirming surgeries. I think the most important concept showing here is the saying that there are so many different kinds of surgeries, and I would say the real full list of surgeries has more than 10 or even more than 20 of them. And of course, it also includes hysterectomy and BSO. I think one of the most important concept is saying that what's called an organ inventory. So no matter it says M or F or anything on my gender marker on the CMS, we actually have to still go through the same thing, right? You have to still ask for past medical history. You wish to know maybe if I've done any kind of surgeries or taking any kind of medications. Knowing what kind of organs that I have, for example, in my abdomen is actually the same for everyone. And I would also say that there are really so many different expectations and needs regarding surgeries, for example. So, for example, myself, having top surgery is something really important to me, as gender dysphoria related to my chest have been something very stressful for me since puberty. So and I also know that, well, chest binder or something else, they're not really helpful at all. And so doing top surgery is something very relieving for me. But however, personally, I have no plans for other surgeries, including well, hysterectomy or BSO or phalloplasty. I would just say that I just don't feel a lot of gender dysphoria towards my, well, lower parts, but it may be different for someone else. And so this is also involving why we are having informed healthcare decisions all the time in different fields, and also including for gender-affirming healthcare. So apart from considering gender dysphoria, maybe they wish to think about, well, family planning, especially when it comes to governance. Of course, there may be a very long waiting time in the public hospital, so some people may wish to consider if they can afford overseas or private services. I think it's also very practical, especially for me as a junior MO. I have to count how many days of annual leave that I have, or maybe the recovering time. And we know about, well, recent complications and other things for considerations as well. I think I would just quickly say that for those that who don't want to have surgeries or don't feel so much dysphoria, they would think that, oh, all these things are really just something they don't want to have. But however, so for someone, if they do wish to have their surgeries, the time or the money or the pain, discomfort, I think all these things would be also mean something to them. So these two pictures are actually talking more related to transgender women and related to so-called bottom surgeries related to the removal of penis, tatas, and also construction of a vagina. So there's actually previous survey, just a very short one. We asked about our friends. So it's actually quite similar to what the largest survey covering more than 200 transgender individuals as well. So we will know that those who really wish to have the surgery is mostly related to the gender dysphoria related, well, to the sex organs. So there's also something why they just really, well, have these kind of surgical changes. But for those who don't want to do it, you will see that it also related to gender dysphoria as well, and a lot of really practical considerations. So I'm sure that all of you will understand that there has been a really major undertaking related to surgeries, hormones, and any other healthcare decisions. So in this very last few slides, as we are thinking about, well, I do hope that maybe I don't will be not admitting to the what someday, but it's always important to think about, well, what really would be an inclusive healthcare services. So something from the WHO, and we're also understanding that, for example, guidelines or more good practices are also in a way internationally. So as for more of the local resources, we also know that in the government, that's the CMAB, the Constitution and Mainland Affairs Bureau, since 2019, that has been training resources related to being LGBTQI plus inclusive. And just very quick note, and I'm sure that some of you may also know about this, on the My HR app, well, the same one you take a look at your search, at your salary, there's also an internal training courses, maybe the first in the hospital authority, about better communications with LGBTQI plus individuals. And I would say that those 5 demonstration videos there that talks about what Simon misgendering, especially related to trans individuals, are really useful. I think there has been so many things that have been covered in this section. Maybe using more of myself and as an example, and also emphasizing the significance of gender-affirming healthcare than maybe on someone. I would do think that the reason why sometimes we say, oh, I am well, 1 year on T, 2 years on T, or maybe someone stressing on these kind of dates, is that it really feels like a birthday to them. I do feel that in this recent about 5 to 6 years, it seems like my life has just begun. And also with echoing with what Pride Month and the significance, I think it's also important to know that apart from being proud of who we are, just as we're having different identities, it may be difficult to imagine that someone since very young may be worrying that they may be having diseases, or maybe worrying that their difference with others people would be something bad. So in this kind of growing up, I think when you come to a state that you can be just at ease with yourself and also be proud of who you are, this would be what we are usually referring in this kind of problems. So it also related to why there may be flags and so many different celebration, just a celebration of who we are and how we are living. And of course, as healthcare workers, I do think that inclusive healthcare services are not only about people with different sexual and gender identities. When you think about there maybe people with disabilities or maybe with different ages and different ethnicity, I do think this is all just reminding all of us again to think about all the different backgrounds of our service users and to able to provide a really high quality healthcare services as we intend to. And that would be the end of this section. And do hope to have more discussions or maybe Q&A in the Q&A section. Thank you very much.